Hello, everyone. I'm Dr. Alan Mandell, and I want to share something with you today that could literally save your life or the life of someone you love. Every single year, more than 36 million Americans fall. And here's the number that stops me in my tracks every time I say it out loud. Falls are the number one cause of injury-related death in adults over the age of 65. 1 in 4 people over 65 will fall this year, and many of those falls could have been prevented. Now, you might be thinking, Dr. Mandell, I'm careful. I watch where I'm going. And I believe you. But here's what most people don't know. The danger isn't just about paying attention. A lot of it comes down to one part of your body that most doctors never talk about: your calves. That's right. These two muscles, right here on the back of your lower leg, are your body's primary defense against falling. They control your ankle stability, your push-off when you walk, and most importantly, they help your nervous system make split-second corrections when you start to lose your balance. When they get weak, and they do weaken as we age, your risk of falling goes up dramatically. But here is the good news I want you to hear today. Your calf muscles respond to exercise faster than almost any other muscle group in your body. Even in your 70s, even in your 80s, it is never too late to rebuild this strength. Today, I'm going to show you 7 simple exercises you can do right at home. No equipment needed, most of them right from a chair, that will strengthen your calves, sharpen your balance, and give you the stability and confidence to move through your day without fear. And make sure you stay with me through exercise number 4. I've been in practice for decades, and that single exercise, which most doctors and physical therapists rarely teach, may be the single most important thing you do for your balance today. I'll come back to it. Don't go anywhere. Let's get started. Before we get into the exercises, I want to take just a minute to explain why the calves matter so much. Because when you understand what's happening inside your body, you'll be far more motivated to actually do these exercises every day. Your calf is made up of 2 primary muscles. The gastrocnemius, that's the larger, more visible muscle on the back of your lower leg, and beneath it, the soleus, which is a deeper, flatter muscle that runs closer to the bone. Now, together, these muscles do something remarkable. They act as a second heart for your body. Every time you take a step and your calf contracts, it pumps blood from your legs back up toward your heart. This is called venous return. When your calves are weak, that pumping action fails, circulation suffers, and your legs feel heavy, tired, and unsteady. But there's something even more important happening. Your calves are the primary drivers of what we call proprioception, your body's ability to sense where it is in space. Tiny nerve sensors in your calf muscles and ankle tendons are constantly sending signals to your brain. I'm shifting left. I'm on an uneven surface. I'm starting to tip. When your brain gets those signals in time, it can fire the right muscles to catch you before you fall. The problem is this. After the age of 60, a condition called sarcopenia, which simply means age-related muscle loss, begins to accelerate. Studies show we can lose 3 to 5% of our muscle mass per decade starting around age 30, but after 60, that rate speeds up. The calves are among the first muscles affected, and as those muscles shrink, Those proprioceptive signals get weaker, slower, and less accurate. The result? You trip more easily. You recover from stumbles less effectively. Small variations in the ground beneath you, a crack in the sidewalk, a thick carpet, a step you didn't see, become genuine hazards. But here's what I want you to take away from all of this. These muscles can be rebuilt. Consistency is everything. Just 5 to 10 minutes of calf-focused exercise each day can make a measurable difference in your balance, your circulation, and your confidence, often within just a few weeks. So let's build them back up together. Here we go. Exercise number 1 is the foundation of everything we're going to do today. It's called the standing calf raise, and we're going to do it with a chair for support. Now, you might look at this and think, Dr. Mandell, that seems too simple. Trust me, don't underestimate it. When done correctly, this exercise activates both the gastrocnemius and the soleus simultaneously, strengthens the Achilles tendon, and begins retraining your ankle stabilizers. This is the exercise I recommend every single patient over 60 add to their daily routine. Here's how to do it. Stand behind a sturdy chair. A kitchen chair or dining room chair works perfectly. Place both hands lightly on the back of the chair for support. Your feet should be hip-width apart, toes pointing forward. Now, slowly rise up on the balls of your feet as high as you comfortably can. Hold that position at the top for 1 to 2 seconds. Feel that contraction in the back of your lower legs. Now lower yourself back down slowly, nice and controlled, so your heels gently touch the floor. That's 1 repetition. I want you to focus on the lowering phase just as much as the rise. That controlled descent is called an eccentric contraction, and it's actually where a lot of the strength building happens. Do this for 2 to 3 sets of 10 to 15 repetitions. Take a 30-second rest between sets. Dr. Mandell's coaching tip: don't bounce at the bottom and don't rush at the top. Slow, controlled movement with a full range of motion will give you far better results than doing this quickly. Quality over quantity always. Exercise number 2 is for those days when standing isn't comfortable, or for anyone who is just starting out and wants to build strength gradually before progressing to a standing position. This is the seated calf raise. Don't let the seated position fool you. This exercise specifically targets the soleus muscle, which sits beneath the gastrocnemius and is actually more active when the knee is bent. The soleus is critical for venous return. Remember that pumping action that sends blood back up to your heart? People who struggle with ankle swelling and heaviness in the legs almost always have a weak, underworked soleus. Here's how to do it. Sit toward the front edge of your chair with your feet flat on the floor, hip-width apart. Sit up straight. Good posture matters here, so don't slouch back. Now, keeping your heels on the ground, raise your toes and the front of your feet up as high as you can. Hold for a second. Lower them back down. Then, raise your heels as high off the floor as you can, keeping your toes on the ground. Hold. Lower slowly. That's the full sequence. Toes up, hold, down. Heels up, hold, down. Start with 2 sets of 12 to 15 repetitions of each movement. As you get stronger, you can add light resistance by placing your hands on your thighs. Dr. Mandell's coaching tip: This exercise is also wonderful to do throughout the day, anytime you're seated watching television, working at the table, or riding in a car. Those short, frequent sessions add up and can make a real difference in your circulation and ankle strength over time. Exercise number 3 is one of my favorites because it trains your balance dynamically, meaning while your weight is actually shifting. This is exactly what happens when you walk, when you navigate uneven terrain, and when you stumble and need to recover. It's called the heel-to-toe rock. As we age, many of us develop what I call a shortened gait. We start taking smaller, shuffling steps without even realizing it. Part of the reason is that the muscles controlling the heel strike and the toe push-off phase of walking become weak. This exercise reactivates that full stride and improves proprioception from your heel all the way through your toes. Here's how to do it. Stand behind your chair, hands lightly resting on the back for support. Feet hip-width apart, standing tall. Slowly shift your weight backward onto your heels, lifting your toes off the ground. Hold for 2 seconds. Feel the muscles working in your shins and the front of your ankles. Now rock your weight forward onto the balls of your feet and your toes, lifting your heels off the ground. Hold for 2 seconds. Feel the calves engage. That's one full rock, back to heels, forward to toes. Do this for 2 sets of 10 to 12 slow, controlled rocks. Dr. Mandell's coaching tip: as this gets easier, challenge yourself by loosening your grip on the chair, just fingertips touching rather than the full hand. Eventually, you may be able to do this with your hands hovering just above the chair without touching it at all. That's when you know your balance is truly improving. All right, I promised you exercise number 4 back at the beginning of this video, and here it is. This is the one, the single leg calf raise. Now, I want you to understand why this exercise is so different from everything else we've done so far. Every single step you take in real life is a single leg event. When you walk, for a fraction of a second, your entire body weight is balanced on one foot. When you step over a threshold, when you climb a stair, when you reach for something and shift your weight, all of that happens on one leg at a time. The problem is, most calf exercises are done on 2 legs, and while those are important and we absolutely need them, they do not train the unilateral, meaning one-sided, strength and stability that your body actually needs to prevent a fall in the real world. Research shows that the ability to perform a single-leg heel raise is one of the strongest predictors of fall risk in adults over 60. It tests not just calf strength, but ankle stability, proprioception, and your nervous system's ability to coordinate a complex balance task in real time. Here's how to do it safely. Stand beside a wall or behind a sturdy chair. Place one hand on the wall or the back of the chair for support. Lift one foot slightly off the ground by bending that knee. Now, slowly rise up on the ball of the foot that's on the ground as high as you can comfortably go. Hold at the top for 1 to 2 seconds. Lower yourself down slowly and with control. Do 8 to 10 repetitions on one side, then switch feet. Start with 2 sets on each side. If this is very difficult at first, that's completely normal, and it's actually important information because it tells you exactly where your balance needs the most work. Dr. Mandell's coaching tip: do not grip the chair or wall tightly. The goal is to use it as a gentle safety net, not as a crutch. The more you rely on your hand, the less your calf and ankle are doing the work. Touch it lightly, feel your calf working hard, and over time, your single leg balance will improve in ways that carry directly into your everyday walking. Exercise number 5 moves our focus slightly but stays in the same neighborhood. We're going to activate what I call the foot-calf connection, specifically the small intrinsic muscles of the foot that work in partnership with your calves to give you grip on the ground beneath you. Think about it this way. Your calf muscle pulls on your Achilles tendon, which connects down through your heel and into your foot. If the muscles of your foot are weak, the communication between your calf and the ground breaks down. It's like having powerful brakes but worn-out tires. The power is there, but the grip isn't. This exercise is called the toe scrunch, and you can do it seated. Sit comfortably with both feet flat on the floor. If you want, place a small towel flat on the ground under your feet. Now, curl your toes down and try to scrunch or grip the towel, or just the floor, pulling it toward your heel. Hold that grip for 5 seconds. Release. Then, spread all 5 toes wide apart, as wide as you can. Hold for 3 seconds. Release. That's 1 set. Do this 10 times on each foot. After that, do toe raises. Lift all your toes off the ground while keeping your heel down. Hold for 3 seconds. Lower. Repeat 10 times. Dr. Mandell's coaching tip: the vast majority of people have never intentionally exercised their toe and foot muscles in their entire lives. These muscles may be quite weak at first, and that's okay. Consistent daily practice of this exercise will gradually restore grip strength and ground awareness in your feet, which directly reduces your risk of slipping or stumbling. Exercise number 6 is one that I love prescribing because it accomplishes 3 things at the same time: joint mobility, blood circulation, and neuromuscular coordination. As we age, the ankle joint can become stiff. Stiffness means reduced range of motion. Reduced range of motion means your ankle can't make the micro adjustments it needs to when the ground shifts beneath you. This is why so many people over 70 turn an ankle, not because the ankle is weak, but because it simply can't move quickly enough in the right direction. This exercise is called the ankle alphabet. Sit in your chair and extend one leg out in front of you, heel resting on the floor. Using only your foot and ankle, not your whole leg, trace the capital letters of the alphabet in the air. A, B, C, D, all the way through Z. Make your letters as large and deliberate as you can. Really move through the full range of motion. This activates muscles and tendons around the entire ankle joint, front, sides, and back, in a way that almost no other exercise does. After completing the alphabet on one side, switch to the other foot. Then finish with ankle circles. Rotate your foot in large, slow circles. 10 rotations clockwise, then 10 counterclockwise on each foot. Dr. Mandell's coaching tip: the ankle alphabet may seem simple, but I want you to pay close attention to whether you notice any stiffness or restriction on one side versus the other. Asymmetry is a warning sign. If one ankle is significantly stiffer or more restricted than the other, that's worth mentioning to your doctor. Imbalances like that can quietly increase fall risk over time. We have reached exercise number 7, and this is the one that ties everything together: We've built the foundation: the calf strength, the ankle mobility, the foot grip, the single leg stability. Now we're going to add speed and coordination, because real-world balance isn't just about being strong, it's about reacting quickly. When you stumble, you don't have 3 seconds to respond. Your nervous system has a fraction of a second to fire the right muscles in the right sequence to catch you. This is called reactive balance, and it depends on something called fast-twitch muscle fibers, the quick response fibers that are the first to go as we age. This exercise is called step tapping and march in place, and it reactivates those fast twitch fibers in your calves and legs. Stand behind your chair with both hands lightly on the back. Begin by alternating tapping your feet on the ground, right, left, lifting each foot just a few inches off the floor with each tap. Start slowly, then gradually pick up the pace. Do this for 30 seconds. Now transition into a gentle march in place, lifting your knees slightly higher, continuing to alternate right and left. Keep your posture tall. Look straight ahead, not down at your feet. 30 seconds of marching. Then rest for 30 to 45 seconds and repeat the sequence 2 more times. Dr. Mandell's coaching tip: looking ahead, not down at your feet, is critical. Your eyes play a major role in balance, and training yourself to walk and move while looking forward rather than down at the floor is one of the most important habits you can develop for fall prevention. Many falls happen when people look down and lose spatial awareness of what's around them. Before we wrap up with some safety reminders, I want to share a bonus tip that I give to many of my patients, especially those who struggle to fit exercise into their day. The truth is, you don't need to do all 7 of these exercises every single session. What I want you to do instead is build a simple 2-minute morning protocol using 3 or 4 of these movements, and do it before you take your first steps of the day. Here's why the morning matters so much. When you've been lying down all night, your calf muscles are cold, your circulation is slower, and your proprioceptive system hasn't yet woken up. The moments right after you get out of bed are actually among the most high-risk moments for falls, and most people don't know that. A simple morning sequence might look like this. Begin seated on the edge of the bed with 30 seconds of seated calf raises and ankle circles to warm up the joints and begin circulation. Then stand with the support of a nearby dresser or wall and do 10 standing calf raises. Follow that with 10 heel-to-toe rocks, and finish with 30 seconds of gentle marching in place. That's it, 2 minutes, done before you've even left your bedroom. Do this every single morning, and I promise you, within a few weeks you will notice a difference. Your legs will feel more awake in the morning. Your first steps of the day will feel more stable. And over time, that consistency will translate into real, lasting improvements in your balance and your safety. Now, before I let you go, I want to talk about safety, because you matter too much to skip this part. All of the exercises I've shown you today are designed to be gentle, accessible, and appropriate for most adults over 60. However, there are some situations where I want you to check with your doctor or healthcare provider before you begin. If you have had recent surgery on your knee, hip, ankle, or foot, please clear these exercises with your surgeon first. If you are currently experiencing acute pain in your leg, calf, or ankle, stop and get that evaluated before exercising. If you have severe peripheral neuropathy and have limited sensation in your feet, work with a physical therapist who can monitor your balance and safety closely. And if you have a history of blood clots or deep vein thrombosis, please speak with your doctor before beginning calf exercises, as some movements can affect circulation. For everyone doing these exercises, always use your chair or wall for support during any standing or balance exercises until you feel fully confident. Never push through sharp pain, and go at your own pace. There is no race here. I also want to be clear. Everything I share in this video is for educational purposes only. I am a doctor of chiropractic with decades of clinical experience, and my goal is always to empower you with knowledge. But this video is not a substitute for the personalized medical advice of your own physician. Please work with your healthcare team and let them be part of your journey. I want to leave you with this thought. Every year, I see patients who tell me they gave up on exercise because they thought it was too late. They thought their body had changed too much. They thought the window had closed. And every single time, I tell them the same thing I want to tell you right now. It is not too late. Your body is remarkable. Your muscles are listening. Your nervous system is waiting to be retrained. And the calf, this humble little muscle on the back of your leg, is one of the most responsive, most trainable muscles in your entire body, at any age. 5 minutes a day, 7 exercises. That's all it takes to begin protecting yourself from the #1 cause of injury in older adults. You have everything you need right here, right now. I am so proud of you for taking the time to watch this today. That decision, choosing to learn, choosing to move, choosing to take care of yourself, that is what healthy aging looks like. If this video helped you, please give it a thumbs up. It helps more people find this information who need it. Subscribe to Healthy Aging America if you haven't already, and click that bell so you never miss a new video. I release new health and exercise content every week, all designed specifically for you. Leave a comment below and tell me, which of these 7 exercises surprised you the most? I read your comments personally, and I love hearing from you. And please, share this video. Share it with a friend, a sibling, a neighbor, anyone you care about who is over 60. You could be the reason they don't fall this year. That is a gift worth giving. This is Dr. Alan Mandell reminding you, take care of your body because it is the only place you have to live. God bless you, and I'll see you in the next video.